Hi guys, welcome back to the channel. Today's episode is one you don't want to miss. If you are a mom, if you're a parent out there, first time mom, new mom, caregiver, this is a video for you because we have an amazing pediatrician here and he's going to be answering all our medical and health questions, telling us some of the mistakes that we are making, and generally we want to know how can we keep our kids safer and more healthy. So keep watching. This episode has been shot from Serene Beauty. Serene Beauty is a team of creative hair and makeup stylists ready to make your wedding day beautiful. Apart from ensuring that they enhance your beauty, they have bridal space in 5 apartments to accommodate their bridal teams so that the day is stress-free. Stay here with your bridesmaids, take pictures, have breakfast, and start the day right. You can check out their Instagram page and book your appointment today, or use the number on the screen and get ready to celebrate love just right with Serene Beauty. On the channel we have Dr. Daniel. Welcome to the channel.
Thank you very much, Lisa. How are you?
I'm good. How are you doing?
Very well, thank you.
Oh, yeah. So just introduce yourself. Who are you? What do you do? Let the viewers know. Yeah. Do you have authority on this matter?
I'm a hustler. We'll start with that.
Okay. Yeah.
No, my name is Daniel. Daniel Tumwine. I'm a pediatrician by training. Okay, at least that's what the large community in this town knows me from. I've been a pediatrician for almost close to 17 years now.
Wow.
Isn't that so? Yeah, I think, yeah, around 17 to 18 years. And I've been practicing half of it, a lot of it. And, but not only that, I'm a person who believes in transforming society. Yeah. So not only am I a pediatrician, I used to teach quality of care, quality of healthcare at the university and also in 13 African countries. So one of the reasons, so while I was teaching how to ask health workers to have a quality improvement mindset, I used to look for examples in the healthcare sector of, you know what, be like these people. And very quickly I realized the examples were very few. And on the other side, I had in the community, I had a lot of mothers complaining about quality of care that was given out in different centers. So I decided to quit and start up children's clinics and become an entrepreneur. So right now, I have 4 clinics: Children's Clinic Nadia, Children's Clinic Nigeria, Children's Clinic Gayaza, and Children's Clinic Isasi. Wow. And that is where I serve. Amazing. And of course, I've also tried to engage social media in my previous life, giving free talks, giving free information, because I realized very quickly that a lot of information was out there that needed clarification. Yeah, so I'm a pediatrician. I run 4 children's clinics. I'm a quality of care expert. I do a lot of teaching. And also I sit at the council, the Uganda Medical and Dental Practitioners Council. What we basically do is that if you have an issue with any doctor, we come in and regulate the doctors and make sure that the quality of care that is being given in town or in Uganda is actually up to standard. So that's sort of some of the things I do professionally. Yeah.
We're in good hands, that means.
Not necessarily.
We're in good hands.
Yeah.
Okay. Okay, so why pediatrician? Why did you become
Why pediatrics?
Yeah, pediatrics. That's the word. Why pediatrics?
No, pediatrics. First of all, I'm claustrophobic, so I didn't like. I loved surgery. I loved opening up and taking out stuff and then closing. I liked being in the theater, but I found it pretty claustrophobic. Yeah. And but what I liked about so that was an option to specialize in. But the key reason I love pediatrics is that you have the innocence of children. When a child falls sick, they don't lie, unlike many adults. a child can come in gasping, and in 30 minutes can be running around on the floor of the hospital, and you will just see.
Yeah.
For many adults, I found them a bit hard and tedious and depressing when someone is really, really ill, and you know, because when you're in a teaching hospital, you see the severe cases, especially with adults. And I was trained in the era of HIV before ARVs became very ubiquitous. And so you saw the very, very severe conditions, and half the time the patients died, and it was really, really sad. So I prefer the happy atmosphere of children. You could do an intervention, and almost immediately you could actually see that these children are going to be well. Yeah.
It's nice, amazing, yeah. Sometimes you have your little one, they are almost dying, you're calling the doctor, and then you reach and the person is looking as if, okay, you're like, hey, but they may think I'm telling lies, you know, but kids are really so innocent. So I'm a mom of 3, and being a mom, you guys know, you are always panicking, you're not sure if you're doing the right thing sometimes, you know, and from your experience, I'm sure you've seen lots of moms, lots of cases, and you may have some, or you may have seen some mistakes that we are making as first-time moms, or as moms in general, or as parents, because these days even dads are really present. So, you know, one of those things that you see that we are making that could affect our children, our health. Yeah.
Yeah, I'm also a parent. I always tell people that, you know, the Bible is very real when they say a prophet has honor everywhere except his home. Or a pediatrician has honor everywhere except his home. Even in my own home, my own wife will get a lot of information, for example, in different groups, social media groups. And so you'll find that many things that the people are telling her permeate into the home. So I find myself fighting some of the things. So the key things, maybe you want to know the key things that many mothers should understand, or the key misconceptions. So first of all, I think pediatricians are really, I call them monitors and evaluation officers, monitoring and evaluation officers. Their key thing is really just to monitor. And the reason is, if you leave a child alone, in terms of health. Of course, it's important that you shower them emotional love and spiritual love and everything like that. But if you leave a child well alone, the child tends to really get better or grow well. Okay, usually it is eyes on, tries to have hands off a bit. All right. Now you find that many times first-time mothers, because they, you know, no one has really told them, and they haven't gone through that journey. They tend to do a lot of panicking. They tend to do a lot of interventions, and half of the time, when they come to us, the key thing we're trying to do is just reassure mothers. So you find that 70 to 80% of mothers who come to us, half of the time we're just reassuring them, teaching them what to look out for. And so if for me, was to give information to first-time mothers, or to a mother really who wants to understand their child's health, is that most of the conditions your child are going to suffer from your child is going to be well. That's the first thing. Children tend to get infections as they grow, and that's because their immune system is not is not up to speed. Usually, we expect your child's immune system to be well after 6 years, roughly, you know, give or take. And that is why if you go to any children's facility, it's very rare for you to find a child who is less than 5, who is above 5. Because by 5, the immune system is becoming stronger, and then it becomes adult level around 6 and above. So when you start seeing a patient coming in all the time, for example, with coughs and flus above, say, a 10-year-old, there's usually an issue or some kind of underlying issues. But you expect a child who is, say, below 1 year, 2 years, to get at least 5 to 6 coughs and flus in the year. All right? It is expected. In fact, a child who doesn't get, there's usually an issue. If you recall, during COVID, when we were isolating, many children went falling sick. And the reason why many children went falling sick is because they weren't going to school, they weren't interacting with other children with coughs and flus.
The immune system.
And so when the schools reopened, every child in this town fell sick. I remember we used to see around 100 patients a day in Nalia. And in 1 week, after opening, we saw almost 300 patients a day. And that was because for the last 2 years, the children went falling sick. Their immune system wasn't being primed. And so once they went back to school and they were exposed to these conditions, you actually found that the children fall sick. So the first thing I want to always tell mothers is that it is okay for your child to fall sick. It is expected for your child to fall sick. In fact, there's a study that was carried out in the 1950s where they followed up children throughout their lives, from birth until throughout their lives. And they actually found that children who fell sick quite a lot in the first 2 years, specifically through viral infections. So there, you can have conditions like a bacterial infection.
Yeah.
We can talk about that if you want, because I know many mothers are always screaming at me, "Doctor, what is this thing called bacterial?"
Yes.
But your child can have a fever, and the three commonest conditions that cause fever in Uganda, and not the only, but the three commonest are usually, it's either viral infection, the overwhelming majority of the time, so like 80 to 90% of the time your child will have a viral infection. The other is a bacterial infection, and the other is a malaria. So that's why when a child comes and they have a fever, those are the three standard tests we usually want to understand what's going on, so that you can, because the management is different in all three cases. So you find that this study, they followed up these children, and they found that children who had multiple viral infections when they were children became healthier adults, lived longer, did not have cancers when they became elderly, because the immune system was primed from a very early age. And so I always encourage mothers that it is okay. It's actually good news if your child has a viral infection. It's different when your child has malaria. It's different when your child has a bacterial infection. We will think more and ask ourselves, why is this child getting that? So the viral infections are quite common, and I keep telling mothers, viral infections, unless it's HIV or like some other chronic conditions, they all go away by themselves. That's one thing that God did for us. Viral infections are the commonest. The vast majority of viral infections, they will go away even if you did nothing. So your job as a mother or a parent is just to make sure you control, you manage the symptoms.
The fever,
all right?
and stuff.
If I cite on fever,
okay.
yes, to manage the fever, yes. But I can also tell you, did you know that fever is actually a good thing? Now you're going to slap us.
No, I thought that fever is supposed to, it just signals that the body is fighting something.
So it's a good thing.
Yeah, but then if it's too high, again, it can affect the brain and stuff like that.
So fever is a good thing, generally, all right? Fever shows you that your body's immune system is robust enough. In fact, in 2014, the Royal Society of Pediatricians in the UK actually wrote to pediatricians to stop treating fevers in children. But imagine, Lisa, you came to me and I didn't treat your fever.
I'll finish.
All right?
Yeah.
The reason fever is a good thing is really because it's, as you've said, it's a body's reaction to something. All right?
Yeah.
When your immune system is fighting something, one of the bullets it uses causes fever. Okay, so I told you I grew up in an age of HIV. When patients with HIV, because their immune system went down, got something like TB or got something like some other kind of conditions, they never got fevers. So they felt ill, they felt weak, but they never got fever. So when ARVs came and we started giving these people ARVs and their immune system became stronger, what was the first thing they got? They got florid TB with fevers, because now the immune system is reacting to this TB. So in a way, fevers are good, but we also try to control them, you're right, because fevers above a certain temperature is usually not a good thing. You mentioned something about the brain. We'll talk about it. They are called febrile convulsions, which tend to be quite common. There are convulsions which are okay and mothers shouldn't be scared of, and there are convulsions for which mothers should be scared. All right. So there are certain children, for example, who tend to have convulsions, and it's usually in a certain window. All right. But I think we'll have that conversation another time.
Yeah.
But fevers generally are a sign of a strong immune system. All right. So when you come and you have a viral infection, usually what we want to say, okay, so what's the issue? Our patient probably has a flu. All right, and that's and that's the viral infection. It caused the flu and the temperature. You know what?
Yeah.
Your child can survive with the flu. Give lots of fluids, give rest. All right, you can manage your temperature. Sometimes we even ask you just use a small cloth and with warm tepid water and just help to reduce the temperature. All right, we can give you, if you insist, we can give you paracetamol.
You will have to take some paracetamol.
But listen to what I haven't said. What haven't I recommended? I've not recommended
antibiotics.
Well, antibiotics, I can't recommend them because antibiotics are if your child has a bacterial infection. All right, so it depends on where the infection is. Is it in the lungs, and is it in the bones? Is it in the nose? Is it all right? So the antibiotic depends on where on where the infection is. All right. So definitely in viral infections, we do not even think of antibiotics at all. So what I haven't given you is a cough syrup. What I haven't given you is a flu syrup. Guess? Do you know why?
Why?
Yeah, because they are more dangerous than the viral infection. All right. So in 2009, the American Academy of Pediatricians brought out studies which showed that children who took regularly cough medications, a lot of cough medications, some of the ingredients in the cough medications, and also flu medications, their death rate spiked. All right, and so, or if they didn't die, they always showed up in the ER more than those children who didn't. First of all, as I've said, a viral infection is going to come. You'll be well in 4 or 5 days. Your job as a mother is and manage the temperature. That is all. All right, let the body do its work. Now you start giving the child cough syrup. Cough syrup, by definition, is a depressant. It's like alcohol. In fact, if you look at many cough syrups, they have chemicals which resemble alcohol. It's the same thing like with colic. Some of these colic medications, they actually all they're giving you is alcohol for your child to be drunk and stop crying.
Come on.
Yes, you see, by the way, at the end of the day, you're going to realize I don't like medicines. So number one, you don't need to give cough medication. All right, you don't need to give cough medication in children who have viral infections and have a mild cough. All right, and the reason is the cough medication is more dangerous, and it's more dangerous if the child is less than 2 years. It's also moderately dangerous if your child is less than 5 years. All right, and so I have fought this even in my own household. All right, any mother who hears their child coughing.
Of course. Yeah.
So if your child coughs, for example, one of the key things you want to look out for, many times it's just a simple pneumonia, and that's just a cough. All right. What you really want to look out for are really 2 or 3 things. So the first thing you want to look out for is a child who is breathing fast. All right. So if a child hasn't been crying, a child hasn't been running around, and they just come and sit, and is breathing fast, that is pneumonia. Pneumonia is not a cough. The definition of pneumonia is not cough. It is fast breathing. Because when you have a pneumonia, what happens is that you have fluids in your lung. And your body needs a certain level of oxygen, or your brain needs a certain level of oxygen to continue functioning. So if you have fluid in your lungs, what happens when you breathe in the oxygen? The oxygen gets lost in the lungs. So not enough oxygen reaches your body. And what does your body do? It makes you breathe faster so you can get more oxygen. So that's really the very first time. So the very first sign of pneumonia is fast breathing. So I hope your mothers can understand that it is not cough. Anything can cause cough. You can be seated here and cough. There you go. Do you have pneumonia? No, you don't. So the first thing new mothers should know, it's important, is that your child is going to have viral infection. They are going to have, whether you do what, your child is going to have. Most likely they're going to have flu. Most likely they're going to have a cough. all right?
Yeah.
Because that's the commonest, all right? Viral infections can also be diarrhea, all right? But we're still on the flu and the cough. So the danger with the simple pneumonia is it can turn into a severe pneumonia. So that is why one of the signs of severe pneumonia is fast breathing.
Yeah.
Child is fast breathing, it's important that the child is seen, whether there is cough or not.
Okay.
Two, the other causes of fast breathing, of course, like for example, if you have a hole in the heart, there are other causes. But in
The most common, really.
yes, in the community.
Okay.
And then the second thing of fast breathing, of pneumonia, that mothers should actually know about is difficulty in breathing. So there's fast breathing, and the second one is difficulty in breathing. And how do you know that the patient has difficulty in breathing? The earliest sign is your nostrils. You see your nostrils flare, okay? So when a child is breathing, before the difficulty becomes very, very difficult, is the icing my nose? I don't know if that one is.
Yeah.
Okay, so there is flaring of the
nose,
nostrils.
yeah.
It's the first subtle and early sign that this child is having difficulty in breathing. So if you're a mother, your child is breathing fast and they're having what you call nasal flaring, that's a sign of pneumonia. And as it gets worse and worse, then you start, the child starts using the chest muscles to breathe. Because remember, the lungs are becoming stiffer to overcome resistance as they try to bring in more oxygen. So you find the child is breathing and using a lot of muscles. Yeah, and there are other subtle signs. So if your child has a pneumonia, has a viral infection and has a cough and fast breathing, those are the things you want to look out for.
And then you talked about something important there, bacterial infection. We just a few weeks ago, the whole family we were just suffering, and then the kids, of course, got bacterial infections. And where does bacterial infection come from? Because we're having a conversation with some moms, and they said, hey, but back in the day, we never had bacterial infections. You know, how come now they are so rampant? Every time, bacterial infections. What do you have to say?
Bacterial infections come from the same place viral infections come from.
The air.
Yeah, right now as we speak, first of all, right now as we speak, there are germs everywhere, all right? And that is why, for example, if someone has cancer or someone has had, say, a procedure which requires you to either the drugs you're taking have what? The drugs you're taking have makes your immunity low, or your condition makes your immunity low. Those days they would isolate you. The same way we did for COVID, okay? It doesn't mean that when COVID has gone, the bacteria causing, the virus causing COVID has also gone. No. There are so many other viruses. In fact, the viruses that cause COVID, there are 6 types. Okay, and just that the other one that causes death is one which we have tried to has disappeared a bit. Yes, but the others are still there. So in any environment, there is always germs, whether it is bacteria flying around, whether it is viruses flying around, and stuff like that. And so why I told you that your child is going to get viral infections. Oh, by the way, pneumonia is not caused by running in the rain. That's another thing we can talk about. Or in the cold. You putting your child a sweater, or even putting a sweater on your child doesn't stop pneumonia. That's another story. So there are so many germs in the air. So some of them can cause disease. The vast majority don't cause disease, or even if they do, they only cause disease if your immune system is low, because your immune system is very, very robust. So bacterial infections, usually you get them, for example, if you sit next to if it's a bacterial infection that is airborne, you sit next to somebody, you're coughing, and that person has that what we call pathogenic bacteria, a disease-causing bacteria, you get it. Sometimes a bacteria can be a sexually transmitted condition, an STD. Yes, that's a bacteria. So you can either have it as a bacteria or a parasite or some other thing, all right? So you can get it in different ways.
Surfaces. Can you get it from
as long as there's a way for it to breach your immune system. So your skin is a very powerful, immune organ, all right? It's the first line of defense. So if anything that breaches your skin, so the commonest way to breach your skin is through the nose and mouth, and it goes to your lungs. And that's why most bacterial infections, that's where they come from. Not invariably, but many times, yeah? So you get a bacterial infection, or you can get a viral infection. And why is it bacterial infection? And then it can go to a certain area of your organ of your body. All right, so you breathe in something, or for some reason this bacteria has breached the skin. So if it's a bacteria that is causing, say, infection in the liver, the bacteria goes to the liver and you get that infection. It could be an infection in, for whatever reason, it can be infection in the kidneys, it can be infection in the lungs, it can be infection in the ears. That's why sometimes you see there's pus coming out, or, you know, the bacteria, just like viruses, they are just types of germs. All right, so they can cause different conditions. Now, why are we getting more bacterial infections? It's not because we're getting more bacterial infections. It's because we are testing them better and testing them more. So previously, when I was growing up, the biggest we had a microscope. So you go to a hospital. That hospital most likely had a microscope. And the second thing we probably had was either a syphilis test, because at that time there was a lot of syphilis. Yeah, and so everything was either it is syphilis, either it is malaria. And in fact, when we're being taught early on, we're taught that every fever is a malaria until proved otherwise. But then eventually the tests for malaria became cheaper. You didn't need a microscope. So even if you went to Karamoja or some random town, you could easily test for malaria. So then the teaching was only diagnose malaria if you have seen it on a test. Because those days the tests were only in big hospitals. So now once the tests for malaria became cheaper, anyone, even you can test yourself for malaria.
So it's just technology.
So that is one. Two, now everybody does a CBC machine. And CBC, what it basically means complete blood count. So complete blood count, what it means is it tests very many tests, around 15 or 16 tests. It can test your platelets. Platelets are the things that help you blood clot. We can even tell you. So if you have an infection, there's a change. There can be a change in your platelets. There can be a change in different types of white blood cells. Because your white blood cells are the ones which tend to fight disease, unlike the red blood cells which tend to carry oxygen. So when you do the white blood cells, under the white blood cells there are different types of cells. So there are cells which go up if you have a viral infection. There are cells which go up if you have a bacterial infection. There are cells which go up if you have a malaria infection, etc., etc. Yeah. So now, because if you have a machine that counts all those, it's easy to tell that, you know what, this is a viral infection. I can't tell you if the virus is called influenza or not. I'll need to do a specific test. Yeah. But all I'm seeing is your body is fighting a viral infection because the white blood cells that fight viral infections have gone up. Okay. So it's an indicator. If you want me to tell you which virus it is, first of all, we will take more blood. We will do the test. To be very expensive. We will ask you to come back after 5 days when your child is already better anyway. And even by that time, we're not going to change management. So you get my point? Yeah. But if I see that, okay, this patient has stomach ache, has a lot of issues in the stomach, and then I do the test as a temperature and I see the cells that fight bacteria high, I know that most likely the issue is in the stomach. So I know I'll give this antibiotic, which attacks the virus, the bacteria in the stomach, which is different from the ones which attack in the lungs, which is different from what attack in different places. So that's really what the thought process of the doctors are having. So for the mother's point of view, they're always telling you, that's a bacterial infection. That's a bacterial infection. Then the mother will ask, what is this bacterial infection? We can tell it to you, but it won't change management. We can say, okay, we can isolate it. We do blood cultures. Tell you to come back after 4 days.
So that's for bacteria, that's dangerous.
Exactly. So that is why we say, okay, this is a bacterial infection, but most likely we're not going to say, we say it's a pneumonia, okay, bacterial pneumonia. Then we tell you, it's a bacterial nasopharyngitis. So we're telling you that it's a bacterial infection and it's in this place. I think many times what doctors don't do, they won't tell you where the bacteria is. If it's just swimming in the blood, we call that a septicemia. All right? So you should always ask, so where is this bacterial infection?
But do they know? Some may not know.
Yeah, because you'll have an idea depending on the child's condition. Yeah. Right? Usually that's why you find that half the time the back of the child's mouth is red. But if the doctor doesn't look for the red, they will find it's red, there's some little specks of white, and the child has a temperature. That's obvious. That's where the focus of the infection is. And so what you want to do is you give a medication which specifically targets that.
But when you look at the the antibiotics they give us, you find that, one, you're fighting with the child because it doesn't taste so nice. So many parents, moms out there, don't finish the dose, and which becomes even more dangerous. Can you just talk a little about that? Then we can. What they call it?
The biggest threat to medicine is resistance.
Yes.
Okay? It's the biggest threat. And the reason it's the biggest threat is that once the drugs are become resistant, even in the next 20 years and your child has a small infection that now we can treat, there will be no drugs. The reason is, number one, if you look at the pharmaceutical industry, they are not very interested in Lisa and Dr. Dan. They are interested in Pope John Paul or someone in the West, because the drugs will be expensive. They will have a cancer. So all the pharmaceutical companies are making cancer drugs. Yeah. All the pharmaceutical companies are making hypertension drugs because all those people in the West are having, and then they're hiking them for like $100 per dose. All right. So those are the things that the pharmaceutical drugs are making. So if you look at last year, for example, the new drugs that came on board, they tend to be, none of them are antibiotics. Yes, half of them were weight loss drugs. Ozempic. No, why should I make an antibiotic when Lisa can pay $2 million for one shot of Ozempic? So now, most of the drugs that were made, most of the drugs that we're using now were discovered in the 60s and the 70s. So now we have so many drugs that are now becoming resistant, and there are no new drugs in the pipeline because the people who make those drugs are not motivated. They're like, okay, my mom, you help us. There are these Africans who are having bacterial infection. They're like, they're going to pay me how much? Meanwhile, Oprah Winfrey is there looking for another next batch of what? Ozempic. Yeah. So already we're doing badly in terms of the drugs we have. Secondly, when the little drugs we have, Lisa is not finished. Is going to the pharmacy and say, you give me this one. Yeah, they give you that one. You give it at a bad dose. You do this. You don't finish. Resistance. Yeah. All right. Like for example, during COVID, there was a lot of people talking about azithromycin, that it works. It actually doesn't work. And so everyone went and bought azithromycin. Yeah. All right. And when they bought the azithromycin, now to give a child azithromycin, half of the time the child won't recover because there's now a lot of resistance because it has been abused. Yeah. So the biggest danger in medicine is not even a doctor, it is drug resistance, and the drugs are being abused. The pharmacies are everywhere now. In our time, to get a pharmacy, you had to walk at least 40 minutes. Yeah. Now there's a pharmacy outside your home.
And they're not sure if they are real.
Yeah, so I wouldn't advise you. I think we don't respect drugs enough. I think that's the key thing.
Yeah, Bambi moms, please finish the doses, even if it's for fighting.
Get the right doses.
Yeah, get the right doses and finish and make sure you do the right thing. Okay, so let's jump to nutrition. You know, as of course parents, the feeding, what should we be giving our kids? Yes, as babies, but also kids who are older. You know, how do we manage the nutrition and make sure?
So let me tell you something. You'll never find in a medical textbook, and you'll never find in a medical school, but something a ped for 10 years and above, well, even 2 years, 80% of the conditions you'll see are basically will not happen if you sort out your nutrition. So the main thing is really about when children come to you, half the time the issue is nutrition. And we underestimate when someone says you are what you eat. All right. And unfortunately for us mothers in this town and in this place, in this country, we are not really well educated on the importance of nutrition. Nutrition, or let's say the first 1,000 days of your child's life are so important.
1,000, yeah.
Are so important, all right? They will determine how healthy you will become. Remember, we said that with these children in their 50s, when we're always falling sick, the others didn't fall sick. your immune system, so your immune system is sorted out in the first 1,000 days. Your IQ, your potential IQ. I remember arguing with some people about certain nutritions, and they said, but for me, I'm intelligent. Yet I took cow milk, etc. Yet the potential is not fulfilled, all right? So we go to nutrition. So the most important thing about nutrition is that the mother, when they're pregnant, should be well.
Starts with the mother.
All right. Yes, it starts with the mother. That is why, for example, during antenatal, they give you iron supplements. They give you ferrous sulfate, I think. Well, different supplements they give you. So that's really to make sure that your child is well. The key issue, it tends to be in the last trimester. So the last 3 months of pregnancy, or the last 12 weeks of pregnancy, really, that's when really the nutrition of the baby really comes in. One of the key things that I like talking about in terms of nutrition is iron. Yeah. And this is why when I look at some mothers and I'm like, oh boy. Iron is so important. Iron, number one, is the most common element in the universe. 2, iron is such a unique element that too much iron is extremely bad for you. Yeah. Too little iron is extremely bad for you. Iron in the wrong form is extremely bad for you. So half of the conditions you see, you can actually tell that this one did not breastfeed. And that's why, yes, that is why, for example, the commonest time for a child to get iron deficiency is around 8 months. Okay, I can discuss that. So the mother ideally should take enough iron during pregnancy. The child ideally should get, any child ideally should get enough iron. What are the best iron foods? I always cheat for my parents. I say, look, for me, I was never an intelligent student, but I had a way to find out patterns. So iron-rich foods, think brown foods.
Beans.
That is extremely iron-rich. Another one?
Brown.
Kalo.
Oh, yes.
Liver, meat, all right? So think of brown bread, grain, all right? So you always found a pattern that was very easy to remember. And so people will say, hey, doctor, that wasn't a doctor. How did you get 100 in biology? Oh, biology has patterns, all right? So as a mother, think of the brown foods. Give the brown foods to your children. They are superfoods. So brown foods plus dark green vegetables, you have enough iron. All right? That's the simplest thing I can give to a mother. I don't even have to give you a list. Okay? Anything that looks brown on the child's plate, you're good to go with iron. Now, why is this important? It's important because a lot of conditions we are seeing in the below 1 year, around 2 years, your child's immune system is not yet well formed. And a very important component of the immune system is iron. Let's talk about iron for the child. So when the child is born, what do you feed them? Breast milk. Breast milk has iron. It may not be 100% iron, but it's enough for the child for the first 6 months. Yeah. All right? Now, so unfortunately what people do is that because of lack of breastfeeding, many reasons why parents may not breastfeed, you find that they start introducing things like cow milk, things like whatever. Now, cow milk, as we always say, is made for cows. Now, funnily enough, cow milk has more iron than breast milk. But the cow milk iron can't be absorbed by the child. All right? Now, the breast milk, even though it's less, a lot of it is absorbed. We call that bioavailability, the available iron that actually enters into the body. Yeah. It might be, because if you looked and someone will tell you, no, there is more, you take this, there's a lot of iron in the cow's milk. Yeah. It's there, but it's not bioavailable. Okay. It goes all the way through. And one of the other things, as it goes all the way through, it injures your gut. So your child's gut starts bleeding. And so, number one, as you give cow milk below 1 year, number one, your child is getting a lot of cow milk, but not a lot of iron. Okay. 2, the iron is injuring the gut. All right? And when iron gets in the gut, your child is losing microblood, and that already has iron. So you find a lot of children, by the time they reach 7 to 8 months, they come to us. First thing I look at is their palm. My palm is pink. Half of the kids are brown, light pink, brown. That's usually a sign of low iron. That's usually the commonest sign of low iron. You can just look at it. You can, and I always ask them to compare my hand. You see my trouser? Most of their hands are like my trouser. So you can compare this child. He's 8 months old, and you can know the story. Hi, I breastfeed for 3 months. I had to go back to work.
Yeah.
Then I had to get. Let me not say the brands, and they're just. And I don't know what do these brands do to you mothers?
Okay, first wait. So what you're saying there?
Cow milk is bad
for children. And
below 1 year.
Below 1 year.
Yeah,
and
cow milk is good for children above 1 year, specifically, although not really. And there's a whole controversy here whether this was just a campaign for calcium. Previously, when we were growing up, ads used to talk about, if you want to give your child calcium, give them a lot of cow milk.
Yeah.
Okay, but studies have shown that even if you don't give cow milk, there are places which don't take milk, and they just do the same diet, and they don't have lack of calcium. So that's why for me I'm specifying iron.
So that's what you're saying, because moms will come and say that, I gave my child from 3 months cow milk and they're okay, nothing is wrong. And from what you're saying if you look at your child 6, 7 years, you can know. So that means the effect is long term.
That is why I said, that's why I wanted us to underline the word potential.
Potential.
You understand? You get someone, so let's say in the West or in Karamoja, where they take cow milk from a young age, they will swear by cow milk.
Yeah.
Correct?
Yeah.
Yes, but what is your potential? No one is saying that you're taking cow milk. No one is saying 100% of people who take cow milk are going to have iron deficiency. That's number one.
Okay.
No one is saying that everyone who takes cow milk, their immune is going to be 0. But if your IQ is supposed to be 120 and your IQ as an adult is 106, there's a very big chance that the reason you're not 120 is because you take a lot of cow milk when you're young, right? Because your child needs a lot of nutrients that only the breast milk can give. So the benefits of breast milk: 1, is protective against allergy. 2, it's protective against infection. 3, those are it helps in growth. There's a lot of benefits in breast milk that I don't even. Sometimes I'll be insulting the mother if I told them, you don't know the benefits of breast milk. I think many mothers know and appreciate that. And very many mothers want to do what? Want to breastfeed. Yeah. So the key issue here is my beef is introducing bad alternative feeds. Yeah. You understand? So one of the things, I'm on a crusade. I'm a hater of cow milk. All right?
Yeah.
The reason I'm a hater of cow milk, number 1, we've said, you're losing out iron. So your immune system is just doing badly. 2, cow milk has certain proteins which are going to cause your child's kidneys to be spoiled. Okay? I don't think you guys appreciate what kidney damage is. You're damaging your children's kidneys at a very young age because of the proteins that are there. 3, there's a lot of studies that have shown that children who get cow milk, they get a lot of allergies later in life. So here you are, you're starting off at a bad footing to give cow milk. Yeah. And so I always say, look, as far as possible, try and breastfeed. If you can't breastfeed, as far as possible, pump and store. Okay. I assume your audience are able to pump.
They can't pump. They can't pump.
Yeah. And then of course, if not, we can discuss formula. Formula is also part of cow milk, but some of the formula they try to put in some substances to assist. And then after that, you do raw cow milk or cow milk itself. That's the worst. So I keep telling mothers, breast milk, no, this is the ideal. Yeah. This is formula, and cow milk is really down here. So for you, I can listen to you about cow milk down here when you are from a refugee camp in I can't remember which refugee camps are in Uganda. Yet Changwali, there's one there in Fort Portal. All right, so fine, I understand. Yeah. Okay, there we have seen the circumstances. Okay, let's do cow milk because you know what? The alternatives are not possible. You can't be with your child.
Alive is what you need now.
You understand? But a mother who comes to me in children's clinics, Nalia, they have their Mercedes Benz, they are working for MTN, they're working for you, or Lisa is coming. Lisa is coming to me, and you are there on cow milk. No way, we don't even start. My professors, when used to come with bottles for whatever, first thing they did was throw the bottle into the dustbin and we discuss your child's nutrition. So,
so the debate, it cannot even be a debate. Breast milk formula or cow milk, like, no please.
To me, it's not a debate. Yes, but of course, you have to also be sensitive and empathetic to mothers who have no breast milk. Yeah. And I'm putting that in quotes. And I know that there are many mothers. So there are two different sets of mothers. There are those who should not breastfeed. So for example, you have active TB, you have, well, HIV depends. All right, if you can afford not to breastfeed, fine. If you're on ARVs and your HIV is suppressed, it's fine. But if you can afford alternatives, no problem. So there are many other, Ebola, for example, there are things we say, do not breastfeed. You have cancer of the breast, do not breastfeed. All right, so there's that group, it's very small, it's almost minuscule. Then there's this group where it's just been difficult to breastfeed because the milk is not coming. Half of the issues of milk are not nutritional. Half of the issues of why you fail to breastfeed tend to be educational. All right? Yeah, I know we're going. Yeah, we can fight on that one.
We can fight.
Yes, but
sometimes just refuses.
Correct. So there are many reasons why
it refuses.
There are very many reasons. It could be psychological. You're going through a lot of stress.
Depression.
All right. Yeah. Well, not just depression. Yeah, because postpartum issues, you can have a lot of depression in there. But the key issue is usually skill. That's one of the things I've found. All right? Actually, that's not really true. The key issue is, it's skill, but also early latching. So, for example, when you're in hospital and you've pushed, many times, say if you've done a cesarean section, what do the nurses do to you to feed the child? They tend to give glucose, they tend to give alternative feeds. That act alone can predict that your child is not going to breastfeed. So we really, really discourage it. All right? We call them prelactio feeds. If the first thing you give a child is not breast milk, there is an issue. All right? And we really, really discourage it. And I don't know why many nurses really persist with that, because we can do so many things with it. And there's a whole fascinating science around that. For example, it can predict whether you're going to get asthma or not. Just that act of giving non-breast milk to a child. So the idea really is those first days you're teaching the mother. The most important thing you can do as a midwife or as a mother of a mother is to teach your mother how to breastfeed. Right? So the most important thing about, So the most important thing about breastfeeding is latching. And I'm sure people have heard about latching. So assuming this is your teat, this is your teat, and this is the child's mouth. All right? What you really want to do is have the child not suck, but lap. So this is the child's tongue. I don't know. This is the child's tongue.
Show the camera.
I don't know. We can look for videos. All right? So what you want is not, what many mothers do is they make their child suck. Sucking is actually a bad thing. Number one, it will cause pain eventually. It will also cause cracking and also cause dryness. But number two, it doesn't bring out right at the back. So the whole black area, the whole what we call the areolar tissue, should always be in the mouth, but the nipple should be right at the back so that they lap. The way a kitten laps milk or the way a dog laps with their tongue is exactly what you should be doing for the child. When you do that, the chances of milk coming out is so high. Many times when you see mothers, it's because they have taught their child or the child has taught how to suckle. So that's one. Two, when you start off in a wrong technique, exactly the milk won't come. When the milk won't come, what are you going to do? You're going to go and buy a bottle, a milk bottle with a teat. And then the child is going to learn how to use that teat.
Yeah.
And the moment they learn how to use that teat,
it becomes difficult.
yes, they cannot use the breast. So while there are issues of why it's difficult for mothers, you want to give your child the best chance to be able to breastfeed. Yes. So I'm not saying that it's not impossible. All right, honestly, there are mothers, you've done everything, you've taught them, you've done it, and the milk still refuses. There are medications which can be given, but I'm not a fan, as I said, I'm not a fan of these medications. And you give one and you just see, oh, the milk is just flowing, but they have certain side effects. And once you're breastfeeding, you really want to have as few medications as possible.
Because it can transfer. Okay.
So once you started on bottle feeding, just know it's going to be almost impossible to go back to breastfeeding because now the child has learned the bottle.
Yeah, okay. I hear you. So we've talked about nutrition with really the newborns and the young ones. Can we talk about like the toddlers and those kids in the home really? You know, we have lots of moms who we are giving things that are easy, quick, you know, junk, you know, go to school, we are packing all these things. What do you say about nutrition for those kids, the toddlers and preteens?
Maybe for you toddlers, the key thing that I keep finding that mothers complain about is that when they reach a certain age, okay, toddler age, the children refuse to eat. The appetite goes. I think that's more common than what to eat. I think many mothers actually do understand what they need to eat. You know, it's the same thing that adults ideally need to eat: the fruits, the vegetables, which toddlers don't like. But the key worry or the key pain point with mothers of say 2, 3, 4-year-olds is that yes, the child has been taking feeds. Oh, maybe before we reach there, so yeah, let me go back to the 6-month child. So ideally, you should breastfeed exclusively for 6 months. That means that you don't give any other thing, whether it's water, whether the only thing you need to give is a medication in case the doctor has given you. But everything else, the breastfeeding is good. Now, I find a lot of issues with mothers transitioning. The reason they transition, number one, as I told you, that's mostly cow milk.
Yeah.
They introduce cow milk, and that's just a disaster. But they also fear to introduce certain things, so like meat. I don't know when you introduced meat to your child. I find that between 6 and 12 months, many mothers fear to introduce meat. So I always encourage them, give the children, you know, either pruned meat or you know, or minced meat and stuff like that. It's so important. A superfood is liver, as I've said. So don't take liver when you're pregnant. It's bad for you. But for the child, it has a lot of nutrients. So even as they grow older, so that's to answer your question. One of the superfoods you have is liver. Give them whole foods. So for example, one of the things I don't like is, I don't like tea.
Tea, like the tea.
Black tea.
Black tea.
It also reduces the absorption of iron. It has what we call tannins, and tannins usually antagonize the absorption
of iron. What about if it's in the milk? Still. So the issue is the tea.
The black tea, yes.
Black tea or
yes, black tea.
The tea bag or the tea? Because if I put the tea bag in the milk,
I guess the effect won't be as much.
Okay.
But you've seen somebody having a piece of cassava and black tea, and they lack iron, and then after that they take cow milk, and they wonder why the child is falling sick all the time. Yeah. So the key issue is that around 2, 3 years, depending on really the child. Because for my child started refusing food at 4 years, and me, I was like, phew, I've survived the 2 years, because he was eating through his 2 and 3 years. But most parents start noticing that their children stop eating, or at least they don't. This is what I say. Okay, let me put that in quotes. They don't eat as much as the parents want. Yes, for them they eat as much as they need, but for you want them to eat more. The reason is, when the children are still young, they're growing at a terrific rate, so they're eating. We always encourage the children to eat every 2 hours. All right, there should be something eating, you know, or breastfeeding at least. And then as they grow older, you know, you can reduce a bit. And the reason is that they're using a lot of energy to grow. All right, all the time the calories are being expended. Now, when you reach a plateau around 2, 3 years, the child's not growing as much relative. So the body does not need as many calories. So what does the child do? It's like, Mommy, I don't want this food. They're like, you have to finish your food.
You must eat that.
So ideally, the issue is not the child. The issue is the mother. And the most important thing that I tell mothers when it comes to nutrition and who have issues, who have worries, it's usually to look at the child's weight growth. Okay? A child who is growing, if you look at the child health card, people call it the immunization card. It's not called the immunization card, it's called the child health card. You're supposed to bring it every time your child is sick.
Hey.
Yeah, because a good indicator of health is weight.
The weight.
All right? And just because your child is big and heavy doesn't mean they're a good
Healthy.
weight. They might be good and going down, or they might be good and being flat, but me, I might be small, but I'm following the curve. So the most important thing is actually the curve. All right? So if a child is refusing food, all right, but the curve is still growing, it means they're getting enough calories for their rate of growth. So now, all I have to do is now look at Lisa and I say, now you, Lisa, I have to treat you.
Educate me now.
It is
me
you I'm
who's sick.
treating. Because you want the child to eat according to you. Yeah. So I always tell mothers, let the child eat. It's okay for the child to get hungry.
Yeah.
All right. In fact, you make the child get hungry, and
Hunger is good.
And the child will eventually
Okay.
ask for food.
Yeah.
Yeah. And that's usually a period. So that period tends to happen around 3-4 years, and then it happens again around 6 to 8 years, because the growths tend to grow, spurt, and then stop, then grow again like that. Yeah.
If my kids were watching, I would apologize. I'm sorry. I'm sorry.
You're the one who slapped them to add
I
more
don't
food.
slap for food. But you must eat, eat
Yeah.
what you've been served. Be grateful.
No. So the most important thing you need to do is the quality of food they're eating, okay?
Yeah.
Don't make them eat the junk food. Don't make, last time I saw, recently I saw a child with yogurt on social media, and I was very mad, and I was like, see, this yogurt is very bad for the child. It's processed yogurt, it has a lot of sugar, and everyone was like, let's go, what a child. I'm like, no, this is terrible. Another superfood I like is yogurt, but it's plain yogurt. I don't like
to start it early,
I don't like
plain.
processed
Don't
food.
start with the other
Yeah, so
one.
my mother used to tell us, as long as there are 5 colors on the plate, we are good to go. That's usually a good way to remember good foods.
Okay. Oh, that's amazing. Oh, guys, I hope you're learning something, because I'm seeing everything I need to change at home. So now, you mentioned something there, and it came up, allergies. We are seeing kids have lots of allergies these days. It's maybe itching, the rashes, anyway, allergies. Can we talk about that? What causes allergies, and how can we support our children with allergies?
Yeah. So allergies basically just means, allergies have been with us for forever, but it just means that the body thinks is attacking something, right? So the body has a very serious survey system. Remember we talked about the immune system. The moment there's something, a germ that enters your body, it has to attack it. So sometimes the body meets something that it doesn't know. There's we'll talk about the hygiene hypothesis, and you learn. Hopefully you'll understand. So the body attacks anything it doesn't know. So sometimes in a person who has a lot of allergies, the body attacks itself. So it shouldn't be attacking certain things. It's a bit like an autoimmune system, but usually the allergy means that it attacks something, and when that attack comes, it's too much. The attack is too much. All right? So when your child is in the womb, it's what you call a hygiene hypothesis, meaning that, before we do that, so allergies can be are caused by a mixture of 2 core things. It's either the environment or the genetics.
What about the food?
Or the genetics.
Okay.
All right. So environment or
genetics.
So environment is usually underappreciated, the impact of the environment. Now genetics, usually there are triggers and what, and so you can usually, when a child comes in and you ask them, they have allergies, and you ask the mother, like, the father has allergies, the uncle. So there's usually that, all right? So the people are just prone, all right? But the core issue is environment. Now, the thing that is beginning to get a lot of traction is what we call the hygiene hypothesis. I want to talk about the hygiene hypothesis. It means that children who are raised in a very clean environment tend to be tend to have more allergies. All right. And that's why if you go to the village, it's very hard for you to get a person with allergies, even if they take cow milk. All right, so
you guys are too clean.
Exactly, and that's and I first read it when I was a medical student. They didn't teach it to us, but I remember going to the library and saying, But now it's almost mainstream. One of the core issues is you're in an environment that is too clean. Of course, there are other causes of environment. If you're in a dusty area, if you're in a place where there's pollen, or if you're in a place where there is a lot of industries, you're most likely going to have allergies because there are pollutants that tend to come to you. If you're in a place with a woolen carpet, or if you have pets like fur, so you're most likely. So there's the hygiene hypothesis. Then of course there's smoking.
Like parents smoking around the children.
So there's three things. There is parent smoking directly. The child is directly inhaling. There is the parent smoking when there is secondary smoke. So you're those ends and the child inhales, and inside and the particles go to the chairs. That's also a powerful one. So there's a lot of things. So smoking actually the biggest predictor of allergies is parents who smoke, even if it's one parent who smokes or a person in the house who smokes. That's whether you smoke in the house or not in the house, it's just that. The second thing is the hygiene hypothesis. Now, hygiene hypothesis talks about when you're in the womb, the hypothesis is many, what we call antigens, many substances go through your child's organs, and your child, as they develop, they are telling the child that, you know what, when you get out and you see a dust, don't attack it. All right, don't attack it. So there's the what we call memory cells. So the body remembers. It's a hypothesis. So the body remembers that, okay, if I ever get in touch with dust, I don't need to flare up. When I get in touch with this, I don't flare up. All right. So it's happening all the time. Antigens are being presented to the body all the time, and eventually the body remembers. So when it comes out, and say you touch here, there is no reaction. You touch here, there's no reaction. Now this continues for 3 months after birth. So whatever the child gets in touch with in the first 3 months, they are unlikely to get allergic to it. Right? That is why sometimes I tell mothers, hey, go to the village.
When you're pregnant?
No, even when you've given birth. Even when you've given birth. You know why? So that all that dust and vichi, the child will know, and then they can come back to town. But you see now, guess what? You're born in town, you're in a clean environment, then the child goes to school and they see dust for the first time.
Yeah, like, the body is like, what is this?
Yeah, so that's one. That's a big hypothesis. And I've seen it, a lot of papers are coming out because of that. Then the second thing is really nutritional. And one of the key things we talked about was things like proteins, cow milk proteins, tend to cause a lot of allergies later in life. Bottle feeding, we talked about that. Now, what is so protective is breast milk. So protective. You find that if you get two twins, one of them you give breast milk, the other one you give a bottled milk. The one of bottled milk will have recurrent infections and will have recurrent allergies. The one of breast milk will probably have nothing. All right? So breast milk is such a powerful protector in terms of allergies. Now, what is allergies? So there are different types of allergies. So there's allergy of the skin, we call it. What do we call it? Eczema. Allergy of the eyes. Okay, conjunctivitis. Allergies of the nose, sinusitis. You guys call it sinuses. Allergies of the lungs. We call that asthma. All right. So
asthma is an allergy,
yeah. It's the same thing. So in fact, in some children, you find what we call an allergic match. So the first time they come, they have allergy of the chest, you manage that. Second time, they have allergy, it has moved to the skin. Third time, they have yes, you can see most children, you can actually tell a child who has allergy of the eyes just by looking at the circles of the eyes. They tend to get dark because of the time they're always scratching them. So you see, it's called raccoon eyes. So you find the child is having all that allergy. And then they'll move, and then they'll have sinusitis and like that and like that. And of course, if you ask in the period, they'll say, you know what, we gave cow milk, The father has allergies. For us, we are clean. We don't have those things in our home.
Not that.
In fact, for me, I mop 5 times a day. I'm like, okay.
Causes.
Yeah. So one of the so allergies. Now the thing with allergies is that they are easy to treat, but the easy way to treat is the dangerous way to treat. Yeah. So most mothers, I've seen mothers who were trying to manage their allergies. Most allergies, by the way, will go by around 6 to 12 years. So you get some people who wait persists into adulthood, but for most kids it will go. So you'll find that many mothers, you're trying to treat them without allergies, and without steroids. But then they get steroids, they get well, or they use herbs. They go to a person who's selling herbs. Most of the people who sell herbs, what do? They add steroids.
Really?
And the allergies go,
so
right?
It works, eh?
And then they'll say, "Look, Dr. Dan, you're just not serious."
Hey, this
all right?
Mama
Yeah. So steroids are really bad, especially for children. And for children, they can mess you up, especially as they grow, because growth is really steroids. It's hormones. Steroids are hormones. So the moment you start messing around with hormones for children, that's when you're going to find kids who are very short, who have humps. You will find some of them, if they are females, they're not able to have children because you've messed their ovaries up, because that whole axis is very sensitive to steroids. So as a ped, you want to avoid as much as possible steroids. If you're going to do steroids, you want to do it if the flare-up is acute, and 2, for a very short time, because even going off steroids is an issue.
Yes.
You don't just go.
Withdraw.
Yeah, because steroids are so powerful. If you just went off them, you can end up in a coma. All right. Yeah, and so you need to go off them. So you want to avoid such drugs. Now there are wonder drugs. When you have cancer, we give you steroids. When you have severe asthma, we give you steroids. They are wonder drugs, but they can be abused and they can lead to severe side effects and death. So managing allergies, it's usually steroids, but usually we leave that for the acute phase. If it is a life-threatening illness, someone comes with asthma, what we call status asthmaticus, they can't breathe, they are really doing badly, you give a steroid, right? And we give other drugs, but one of the things you also give is a steroid. Then you taper off them steroids once they've stabilized. So allergies is usually steroids, but now there are so many other things that can help with allergies. So the first thing I always tell mothers, which they hate me for, is stop bathing your children a lot. That's one of the serious causes of eczema.
Of eczema. Bathing your child a lot.
Okay, so eczema is triggered by dry skin. What happens when you wash your clothes or you wash your dishes? What happens to your hands?
They dry out.
So dry skin flares up eczema. The problem with many mothers is that you guys love bathing your children. First of all, when your child is born, you don't want to even bathe her for the first few days. You want to bathe the child after like 4 or 5 days.
Some mothers can't allow immediately.
Yeah, because they have
that stuff.
That's all right. But that's not the key issue. So the key issue is that the more you bathe your child, the more you dry your child's skin, and the more they will flare up. So the idea is you want to bathe them once. Ideally, you want to bathe them once every 2 days. Ideally, but I know there's no mother in Uganda who's going to allow. All right. So I tell mothers, just reduce the amount of time you bathe. If it's just once a day. That sweat, are you seeing when your child plays, even on you, that sweat, all right, that covers the child, it's oil-like. That's a protective. That's very protective. That's more protective than anything you can buy in any market. So the idea is to have, all right, a protective sweat-like thing there, all right? And then when you remove it, at least try and put something. So usually what I tell you is that, number 1, try and bathe a few times. Number 2, when you bathe, make sure there are certain soaps you don't want a scented soap. You want as natural a soap as possible. All right. But number 3, when you bring the child out of the bath, don't remove
everything.
The towel. Yeah, just tap and let the water remain, and then put Vaseline. Actually, for me, the best treatment and the cheapest is Vaseline, because it's petroleum jelly. All right. So you put the Vaseline. You leave the water to be there on the skin, and then you trap the water with Vaseline, with petroleum jelly, and leave the child. All right, and that's just a basic thing for treatment of eczema. And if that one doesn't work and gets worse, then usually what I ask for is you get, and they're mostly not in supermarkets, they're in pharmacies and doing the prescription. They're what we call oatmeal proteins. Okay, so instead of using steroids, you get oatmeal proteins. There's a lot of they're becoming many now. Yeah, and oatmeal proteins have been, at least that one I can guarantee, because the studies have found that children who bathe with oatmeal proteins, you've heard of Aveeno, for example, that's just oatmeal protein. Clabane, that's just oatmeal proteins. So anything with oatmeal proteins, now they do the shower gel. So there's Aveeno eczema, for example, Clabane eczema. There are different types. Then there's the lotion, and they're all oatmeal. So oatmeal has been found by Australian doctors. Actually, they were just looking at Aborigines. You know, people think doctors don't like herbs. They looked at how these Aborigines were protecting themselves against eczema, and so using studies, they found that actually oatmeal proteins are very, very effective. So when you come to me, that's one of the things I give you. Yeah, and also look at your diet, look at the things that trigger you. Yeah, and those are the key things.
Wow.